Most people picture a heart attack the way they've seen it in the movies. Someone suddenly grabs their chest, collapses to the floor, and everyone instantly knows what's happening. The problem is, real life often doesn't look like that. And that misunderstanding has caused far too many people to wait when they should have acted. I've seen patients convince themselves it was just heartburn, muscle strain, or something that would pass in a few minutes. By the time they finally called for help, precious heart muscle had already been lost. I'm Dr. John Myers, and after years of caring for patients with heart disease, I've learned that one decision made in the first few minutes can completely change what happens next. In fact, there are 3 simple actions that can make a remarkable difference if they're done right away. They don't require special equipment, advanced medical training, or years of experience. But surprisingly, most people have never been taught what those 3 steps are, or why the order matters so much. Before I walk you through them, I want you to understand something important. Calling 911 is only part of the plan. There are other choices you make in those first moments that can either give your heart a better chance to recover or quietly make the situation worse. By the end of this video, you'll know exactly what those 3 actions are, when to use them, and why acting quickly matters more than most people realize. Before we talk about what to do, it helps to understand what's actually happening inside your body during a heart attack. The process usually begins when a blood clot blocks one of the arteries that supplies oxygen-rich blood to your heart muscle. Once that blood flow is cut off, the affected part of the heart is no longer getting the oxygen it needs to survive. Every minute that artery stays blocked, more heart muscle is damaged. And once that muscle is gone, it cannot simply grow back. That's why you'll often hear doctors say, "Time is muscle." It isn't just a phrase. It's a simple reminder that every minute matters. The faster blood flow is restored, the more heart muscle can be saved. The longer you wait, the greater the damage becomes. When I think about those first critical minutes, I focus on 3 things. First, how quickly can blood flow be restored to the blocked artery? Second, how fast is the blood clot continuing to grow? And third, how hard is the heart being forced to work while it's already being deprived of oxygen? Those 3 factors have a tremendous impact on how much of the heart can still be protected. The good news is that each one can be influenced by the right actions taken early. That's exactly why the next 3 techniques are so important. They aren't random pieces of advice or old medical myths. Each one is designed to help with one of those 3 critical factors during the first moments of a heart attack. Once you understand that connection, the order of these steps will make much more sense, and you'll see why acting quickly can make such a meaningful difference. Let me tell you about one of my patients. I'll call him Howard. He was in his early 70s and had always thought a heart attack would be impossible to miss. One morning, he woke up with an uncomfortable feeling in the middle of his chest. It wasn't a sharp pain. It wasn't unbearable. To him, it felt more like heartburn after a heavy meal. Because it didn't match what he had seen in movies or on television, he convinced himself it couldn't be a heart attack. He walked around the house for a while, hoping the feeling would go away. He waited. Then he waited a little longer. He kept telling himself it would probably pass on its own. Hours later, when the discomfort still hadn't gone away, he finally decided it was time to go to the hospital. By then, far too much time had passed. The blocked artery had been starving part of his heart of oxygen for hours. Although the medical team was able to save his life, they couldn't save all of his heart muscle. Howard survived his heart attack, and for that he was grateful. But he also had to live with permanent damage to his heart. Everyday activities became more difficult. His energy wasn't the same. His life changed because those first critical hours had slipped away. I want you to remember Howard's story as we go through the rest of this video, not because it's unusual, but because it's something I've seen more than once. And before we finish today, I'm going to tell you about another patient whose story began in almost the same way. The difference wasn't luck. The difference was what happened during those first few minutes, and it completely changed the outcome. Before we talk about what to do during a heart attack, we need to answer an even more important question. How do you know it's happening in the first place? You can't respond quickly if you don't recognize the warning signs. And this is where many people lose valuable time. They wait because they're expecting symptoms that often never come. Most heart attacks do not begin with the dramatic scene you see in movies. They usually don't start with someone suddenly grabbing their chest and collapsing. In real life, the symptoms are often much quieter. Many people describe it as a heavy pressure, tightness, squeezing, or an uncomfortable feeling in the center of the chest. Some don't even call it pain. They simply know that something doesn't feel right. That discomfort may stay in the chest, or it may spread to other parts of the body. It can move into one or both shoulders, down one or both arms, into the neck, the jaw, the upper back, or even the upper stomach. Because the symptoms can travel, people sometimes mistake them for a pulled muscle, indigestion, or another problem that seems much less serious. A heart attack can also cause symptoms that don't seem related to the chest at all. You may suddenly become short of breath even with very little activity. You might break out into a cold sweat for no obvious reason. Some people feel nauseated or lightheaded. Others notice unusual fatigue that seems completely out of proportion to what they're doing. Sometimes it's not one dramatic symptom. It's several mild symptoms happening at the same time. It's also important to remember that not everyone experiences a heart attack the same way. Women often have symptoms that are less obvious than the classic chest pain people expect. The same can be true for people living with diabetes. Their warning signs may be more subtle, making it even easier to dismiss what their body is trying to tell them. So here's a simple rule that I want you to remember. If you develop new chest, discomfort, pressure, or other concerning symptoms that make you think something is seriously wrong, don't sit at home waiting for certainty. Treat it like a possible heart attack until a medical professional tells you otherwise. It's always better to be evaluated and discover it wasn't a heart attack than to wait and find out too late that it was. You are allowed to be wrong. You are not allowed to wait. One more point before we move on. A heart attack and a cardiac arrest are not the same emergency, even though many people use those terms as if they mean the same thing. Knowing the difference matters, because the response is different. We'll come back to that in just a few minutes. After that, I'll walk you through the first of the 3 actions that can make the biggest difference when every minute counts. Now let's move to the first action. And in many ways, it's the most important one. The moment you think you may be having a heart attack, call 911. Don't wait to see if the symptoms improve. Don't tell yourself you'll give it another 15 or 20 minutes. Every minute you spend waiting is another minute your heart muscle may be going without the oxygen it needs. Remember what we talked about earlier. Time is muscle. The sooner blood flow can be restored, the better the chance of limiting permanent damage. That's exactly why calling 911 should always be your first step. Many people believe they'll get to the hospital faster if they simply drive themselves or ask a family member to take them. I understand why people think that. It sounds reasonable, but in most situations, calling an ambulance gives you important advantages that you don't have in a private car. Emergency medical professionals can begin evaluating you as soon as they arrive. They can monitor your condition while you're on the way to the hospital. They can perform an electrocardiogram, or ECG, if it's needed. Just as importantly, they can alert the emergency department before you arrive. That means the hospital already knows a possible heart attack patient is on the way and can begin preparing for your arrival before you even come through the door. Those extra minutes matter. Instead of losing time after you reach the hospital, the medical team is already getting ready to move quickly. There are 2 mistakes I see again and again. The first is waiting to see whether the symptoms go away on their own. People hope it's only indigestion, a pulled muscle, or stress. They tell themselves they'll wait a little longer before deciding what to do. Unfortunately, that's exactly how valuable time slips away. The second mistake is trying to drive yourself to the hospital. Even if you feel well enough to start the trip, your condition can change very quickly. If your symptoms suddenly become worse while you're driving, you could lose control of the vehicle and put yourself and others at risk. That's another reason emergency medical services are the safer choice. When you call 911, keep your message simple and direct. Don't spend time trying to explain every symptom or guess what's happening. Say, "I think I'm having a heart attack." Those words immediately tell the dispatcher this could be a medical emergency and help ensure the right response begins as quickly as possible. Making that phone call may feel frightening, especially if you're not completely certain, but it's always better to ask for help early than to wait until the situation becomes much more serious. The next step we'll discuss focuses on something you can do while that help is already on the way. Before we move on, thank you for staying with me. I hope you're already seeing why these first few minutes matter so much. If you're finding this helpful, please consider subscribing to the channel. My goal is to share clear, practical information that can help you make better decisions in a medical emergency. Now, let's keep going, because the next two steps are just as important and work together with the first one. Now let's move to the second action. This step focuses on the blood clot itself. It's important to understand what aspirin can and cannot do. Aspirin does not stop a heart attack. It does not reopen a blocked artery. But when it's appropriate, it may help slow the growth of the blood clot by reducing the ability of platelets to stick together. That can make an important difference while you're waiting for emergency medical care. This recommendation isn't based on opinion or tradition. It's supported by medical research that has shown aspirin can improve outcomes for certain patients when it's taken early during a suspected heart attack. That's why it has remained part of emergency heart attack care for many years. If emergency services have been called and you believe you're having a heart attack, aspirin may be the next step, provided there isn't a reason you should avoid it. The goal is simple: help slow the clot while trained medical professionals are already on their way. Just as important as taking aspirin is taking it the right way. A regular adult aspirin, or 4 low-dose baby aspirin that add up to the same amount, is commonly recommended in this situation. Instead of swallowing the tablets whole, they should be chewed before swallowing. Chewing helps the medication begin working more quickly than swallowing an intact tablet. When every minute matters, even small differences in timing can be meaningful. At the same time, aspirin is not the right choice for everyone. If you've been told not to take aspirin because of a serious allergy, active bleeding, or another medical reason, you should follow the instructions you've already been given by your healthcare provider. The purpose of this video is not to override medical advice that's specific to you. It's to explain what is commonly recommended for many people during a suspected heart attack. I also want to prevent one very common misunderstanding. Some people hear about aspirin and think, if I take one tablet, maybe I don't need to call 911. That is absolutely not the message. Aspirin is only a supportive measure. It is never a replacement for emergency medical care. The most important action is still the first one we discussed. Call 911 immediately. Aspirin comes after that, not instead of it. Think of it as something that may help while the emergency system is already moving into action. The ambulance should already be on its way. The hospital should already be preparing for your arrival. So remember the order. First, call 911. Then, if aspirin is appropriate for you, chew the recommended dose rather than swallowing it whole. Those two actions work together, and both are designed to protect as much heart muscle as possible while every minute still counts. Now there's one more step to cover. It's often overlooked, but it can reduce the amount of work your heart has to do during one of the most critical moments of your life. Now let's talk about the third action. This one is often overlooked, but it has a very important purpose. During a heart attack, part of your heart muscle is already being deprived of oxygen. Every unnecessary movement forces the heart to work harder, and the harder it works, the more oxygen it needs at the exact moment when oxygen is in short supply. That's why this final step is all about reducing your heart's workload while help is on the way. As soon as you've called 911 and, if appropriate, chewed the recommended dose of aspirin, stop whatever you're doing. Don't try to finish a chore. Don't keep walking around the house. Don't decide to pack a few things before leaving for the hospital. This is the time to let your heart do as little work as possible. Sit down in a comfortable position and stay as calm as you can. I know that's easier said than done. Feeling frightened during a possible heart attack is completely understandable, but panic causes your body to release stress hormones that make your heart work even harder. Instead, try to take slow, steady breaths. Focus on breathing in and breathing out at a comfortable pace. The goal isn't to eliminate fear. The goal is to avoid adding extra strain to a heart that's already under stress. If your clothing feels tight around your neck or chest, loosen it if that helps you breathe more comfortably. Small adjustments like this won't stop a heart attack, but they can help you stay as relaxed as possible while waiting for emergency medical professionals to arrive. If you're home alone, there's one simple step that many people never think about. Before you settle into a chair or another safe place to wait, unlock your front door. If your condition suddenly gets worse and you can no longer get up, emergency responders won't have to lose valuable time trying to reach you. It's a small detail, but in an emergency, small details can make a real difference. This is also a good time to clear up a common misunderstanding. You may have heard people talk about something called cough CPR. The idea is that coughing repeatedly can somehow keep you alive during a heart attack. This advice has been shared online for years, and many people still believe it's something they should do. In reality, that is not the action you should focus on during a suspected heart attack. Instead of trying techniques you've seen on the internet, stay with the simple steps we've already discussed. Call 911 immediately. Take aspirin if it's appropriate for you. Then sit down, stay as calm as possible, breathe slowly, and wait for trained medical professionals to arrive. These actions may seem almost too simple, but that's exactly why they're easy to remember when emotions are running high. They aren't meant to replace emergency treatment. They're meant to give your heart the best possible chance while every minute still counts. Now there's one more situation we need to talk about, because sometimes a heart attack can suddenly become something even more serious. If that happens, the response changes completely. Before we finish, there's one more situation you need to be prepared for. Sometimes, a heart attack can suddenly lead to something much more serious. If the person becomes unconscious and is no longer breathing normally, you're no longer dealing with a heart attack alone. At that point, it has become a cardiac arrest, and the response must change immediately. If this happens, call 911 right away, if it hasn't already been done. Then begin hands-only CPR as soon as possible. Don't wait for someone else to take action. Don't assume help will arrive in time without your assistance. Every minute matters, and starting chest compressions immediately can help keep blood flowing until emergency medical professionals arrive. If an automated external defibrillator, or AED, is available nearby, have someone bring it as quickly as possible and use it by following the voice instructions. These devices are designed to guide ordinary people through each step, even if they've never used one before. I know many people worry about doing CPR perfectly, but in a situation like this, the greatest danger is not making a small mistake. The greatest danger is doing nothing at all. Taking action gives that person a chance. Standing back and waiting does not. The important thing is to recognize when the situation has changed. A heart attack requires one response. Cardiac arrest requires another. Knowing that difference and acting without delay can make all the difference while help is on the way. Before we wrap up, I want to share one final thought. In my experience, the patients who tend to have the best outcomes are often the ones who prepared before an emergency ever happened. They didn't wait until they were frightened and under pressure to figure out what to do. They had already made a simple plan. Start with a few practical steps. Keep aspirin in a place where you can find it easily if it's ever needed. Have an up-to-date list of your medications available, so emergency medical professionals can quickly see what you're taking. Make sure your house number is easy to read from the street. It may seem like a small detail, but it can help emergency responders find your home without unnecessary delays. I also encourage you to talk with your family about what you want them to do if you ever develop symptoms of a heart attack. A short conversation today can prevent confusion and hesitation during a real emergency. When everyone understands the plan, it's much easier to act quickly and stay focused. The goal isn't to expect the worst. It's to be ready if the unexpected ever happens. When you prepare ahead of time, you won't have to make important decisions while you're frightened or trying to remember what you heard in a video. You'll already know the next step, and that can make all the difference when every minute counts. Before we finish, let's quickly review the plan. If you think you may be having a heart attack, the first step is to recognize the warning signs and take them seriously. Don't wait for absolute certainty. If something feels seriously wrong, act. Next, call 911 immediately. Don't delay, and don't try to drive yourself to the hospital. If taking aspirin is appropriate for you, chew the recommended dose rather than swallowing it whole. Then stop what you're doing, sit down, stay as calm as you can, and take slow, steady breaths while you wait for emergency medical professionals to arrive. The goal is to reduce the amount of work your heart has to do during those critical minutes. If the situation changes and the person becomes unconscious and is no longer breathing normally, remember that you're no longer dealing with a heart attack alone. Begin hands-only CPR right away and use an AED if one is available. Keeping these steps in the right order makes them much easier to remember when every second matters. At the beginning of this video, I told you about Howard. I also promised I'd tell you about another patient whose story started in a very similar way, but ended very differently. Her name is Lorraine. Lorraine was also in her 70s. One day, she noticed an uncomfortable feeling in her chest. It wasn't severe. It wasn't dramatic. In fact, she wasn't even sure it was her heart. The symptoms were subtle enough that she could have easily dismissed them, just as Howard did. But instead of waiting, she recognized that something wasn't right and decided to treat it seriously. She called 911 right away. While help was on the way, she followed the guidance she had been given. She chewed the recommended dose of aspirin because it was appropriate for her situation. Then she sat down, stayed as calm as she could, and waited for the ambulance instead of trying to drive herself to the hospital. Because those decisions were made early, everything else happened sooner. The emergency team was ready before she arrived. Her blocked artery was reopened during that critical window when heart muscle could still be saved. As a result, she recovered remarkably well and was able to return to her normal daily life. When I think about Howard and Lorraine, I don't see two people who simply had different luck. I see two people who faced a similar emergency but responded in very different ways. Howard waited because his symptoms didn't match what he expected. Lorraine acted because she understood that a heart attack doesn't always look the way it does in the movies. That's the lesson I hope you'll remember long after this video ends. The biggest difference often isn't what happens inside the artery. It's what happens during those first few minutes after the symptoms begin. The decisions you make in that short period can have a lasting impact on the rest of your life. I hope you never have to use what we've talked about today. But if you remember these 3 simple steps, they could one day help save your own life or the life of someone you love. Take a few minutes to share this video with your family, especially parents, grandparents, or anyone over the age of 50. Knowing what to do before an emergency happens can make all the difference. Thank you for spending this time with me. I truly appreciate you watching. Stay safe, take good care of your heart, and I'll see you in the next video.